dispatched at above time for GSW secondary to bar fight at local drinking establishment. PD is on scene. All other bystanders and family is cleared out. I will don appropriate BSI, gloves, mask, gown. Is scene safe. PD is on scene. Patient has been patted down. No other weapons. From the doorway, we'll assess airway. Patient does have chest rise. Patient does have bloody face and occluded airway. Any circulation issues. Patient does have red staining to shirt. Approach, try to get mechanism of injury is GSW to chest. We have one patient. I'm going to give BLS a call, or see how far BLS is for assessment during transportation. Of partner, maintain C-spine. General impression, again, is GSW. We're going to try to get patient's responsiveness. So, hey sir, my name's Theo. How you doing today? Not getting a verbal response. We'll go ahead and see if patient is responsive to painful. Patient is not responsive. We do still have good distal pulse and good central pulse. This point, we're going to consider life threats. We're going to assess patient quickly from head to toe. Check the head. We do have blood occluding the airway. We're going to have one partner suction that. If suctioning is not adequate, we're going to continue suctioning and attempt ET tube. ET placement is not adequate or is unable to be completed, so we're going to continue suctioning and attempt to place an oral airway if it is accepted. At this point, we're going to go ahead, check neck, no trauma to neck, expose the chest. Chest does show a bubbly chest wound, so we are going to occlude the chest.
Right chest.
Yep. Occlude the chest wound appropriately, and then assess for lung sounds left, right, diminished lung sounds on right side. I will consider getting a chest to third clavicular down to reinflate right lung. Assess abdomen, no other traumas. Pelvis, no traumas. We're going to strip the legs and reassess legs for good CMS. Right, left, good CMS. Arms, right, left, good CMS. At this point, we're going to roll patient maintaining C-spine and airway. 1, 2, 3. Roll the patient. Below the right scapula, we do see another bloody exit wound. We're going to occlude the injury and again assess lung sounds throughout. Going to roll them back. 1, 2, 3. All right. So this point again, we're going to reassess airway. Airway is clear. Breathing. We're getting good tidal volume. Adequate ventilation. We're going to get oxygen going as well with big valve mask. Gently. Don't want to cause additional trauma to the lungs. Get O2 at 12. Managed circulation, again, check pulses throughout. Pulses still good. We're going to get Violet 18s, fluids wide open. We're going to be transporting to the local hospital 5 minutes away for patient stabilization. At this point, we're going to get full set of vitals, including blood pressure, pulse, respirations, O2. I'm going to get a 4 lead on for a quick look. Pulse is 114, pressure is 82/64, respirations are 10 when not being assisted. O2 is 91% prior to interventions. ECG shows sinus tachycardia without ectopy. At this point, we're going to move on to sample history. Signs, symptoms, GSW to chest. No known allergies, no known medical history.
No family.
Yeah, no family, thank you.
Alcoholic.
And last oral intake is alcohol, possibly snacks. Again, we're going to move on to secondary assessment. We're going to check the head, eyes, ears, nose, mouth, make sure eyes are pearl. Go check ears or blood for any halo effects showing cerebral spinal fluid. Airway is being managed at this time. Move down to the neck for JVD. Tracheal deviation or additional trauma. We're then going to do a thorough assessment throughout the chest. Where again, we're going to take a listen to lung sounds, any other traumas, make sure there's no flail chest, no other broken ribs. Abdomen, we're going to assess in 4 locations. Move down to pelvis, press in, press down, no other trauma. Gonna assess right leg, good CMS still. Assess left leg, still have good CMS, no trauma. We'll assess right arm, good CMS, and reassess left arm, no trauma, good CMS. We're gonna roll the patient one more time, maintaining C-spine and airway. 1, 2, 3. Roll the patient. We're going to assess the back, palpate, listen again. Listen in 4 locations. We're going to go to assess the buttocks. Roll them back, maintain airway and C-spine. 1, 2, 3. Roll them down. And lastly, I forgot to double check the patient's genitalia and pelvis. From there, we are going to reassess vitals. We get a pulse of 124, blood pressure of 82/68, respirations are 8. Pulse X is 88%. ECG still shows sinus tachycardia without ectopy. At this point, we're going to be prepping to transport. We are going to reassess if our interventions are in place and are still adequate. Including the occlusive on right chest, right back, 2 IVs, and make sure airway is still being maintained. Other than this, will be prep to transport and end.